I got a question about flu shots. A Prednisone Warrior's wife asked, my husband is on prednisone, and I'm wondering if he should be taking or getting a flu shot or not. And if so, what dose? When should he get it? And what matters? So today I'm going to answer her question and probably some other people's questions about flu shots too. I'm Dr. Megan, your prednisone pharmacist. Once upon a time, about 10 years ago, I gave 200 flu shots in one day. 200! It was the craziest day. And so I am a certified immunizer, and it's been a while since I've given one myself, but I have given lots of flu shots in my pharmacy career. About prednisone and flu shots. First of all, should you get one or not? And it's kind of confusing because prednisone can cause immunosuppression. So does that mean you shouldn't take flu shots or something? Here's the answer. There are different kinds of flu shots. There's the nasal spray, and that is a live vaccine. It's made of a live attenuated influenza virus. And that one isn't really safe for people on prednisone. But the injection, the one that goes in your arm, that one should be safe for people on prednisone. And because it's not a live vaccine, it's what they call attenuated. It's like a killed virus. And so it's not as harmful for people on prednisone. In fact, it's really good because it helps you to prevent what could be potentially fatal, the flu. You do not want to get it while you're on prednisone because you'd have a hard time fighting that. You have a higher risk of pneumonia and other things because you are taking prednisone. So we've talked about live versus attenuated. You want to get the injection. And the Prednisone Warrior's wife, her specific question was, should he get high dose flu vaccine or not? He's over the age of 65, and that's the only people who really need high dose. And so yes, he should get high dose because of his age. It really doesn't have anything to do with prednisone. You can get the high dose vaccine if you're over 65, pretty much no problem if you're taking prednisone. And everybody on prednisone should pretty much avoid the nasal spray. So that was what dose of the flu vaccine. What about the dose of prednisone? Does that matter? So if you are taking prednisone for less than 2 weeks and at a dose of less than 20 milligrams, then you should just wait until you're done with your prednisone. But if you're going to be on prednisone longer than 2 weeks, then you should get the flu vaccine now. There's no reason to wait. The only people who should wait are those who are going to be finishing within 2 weeks. Otherwise, get your flu vaccine, get it now, get that protection in you. But when should you get your flu vaccine? Now is a good choice because it's in stock. And with the epidemic, it might not be in stock. People might, demand it and it might run out like it has in years past. But as far as when is it most effective to get the flu shot? It is the very most effective if you get it in October. If you get it before October, that's good. You're set and ready to go for the flu season. But October gives you 6 months of flu season coverage. There's not a lot of evidence that the flu shot lasts longer than 6 months. So if you get it in August, it's going to run out in February. And if it runs out in February, there's still March, April of flu season that you need to fight. So the very, very best time is October because you're getting it right before the flu season gets strong, but enough time that it's going to last. So that was when to get it. Another question people often ask is, does the flu shot give you the flu? And the answer is no, but it makes some people feel flu-ish. So you might get a little bit of joint pain, you might get achy, you might get a very, very, very slight fever. that makes you feel like you had the flu, but it's not actually the flu. It's just your body's immune response to that vaccine. And unless you're getting an extremely high fever or really extreme symptoms, it's totally normal. That is to be expected. That's your immune system doing its job. And so, no, that's not the flu, and you're good. It's working. But does the flu vaccine sometimes not work? Yeah. The thing about the flu vaccine is they have to guess like a year to 6 months in advance of the flu season what the flu is going to look like. And that means they have to guess how the virus is going to replicate. And that's kind of tricky. They can guess wrong. And it's all based on what the flu was like on the other side of the world. And sometimes by the time it's gotten all the way to the northern hemisphere, it's changed and it doesn't match anymore. And so some years it's a really great match and you're really glad that you got the vaccine. And other years they missed. The scientists guessed, like they shot in the dark and their bullseye was a little off. They were over here instead of smack dab in the middle, right? So sometimes, you might think, oh, the flu vaccine doesn't work. It's not that it doesn't work. It's that year they didn't guess as well as they should have, or as they magically should have. So yes, the flu vaccine works, but humans are trying to predict virus behavior, and that's really hard to do. So it doesn't mean the flu vaccine doesn't work. It means their guess wasn't as good. All right, finally, am I going to get it? And the answer is yes. I'm going to take me and all my kids, and we are going in October to get our flu shots because I have no desire to have a bunch of kids with the flu and wondering, is it flu or is it COVID? Is it flu or is it COVID? Nobody knows. So I'm getting my flu shot. My kids are getting the flu shot. We're all getting the flu shot. So are you going to get your flu shot? I'd love to know. And if this has been helpful to you, please share it. Please like it. Please subscribe to my channel. Signing off as Dr. Megan, your prednisone pharmacist.